is everybody? I believe you are all fine. I welcome you back to my YouTube channel. My name is JEMIENAFTALY and the channel's name is called The Pediatric World, and it's only here that we talk. It's only in this platform whereby we talk, we discuss, we want to create the awareness. We want mothers to have the know-how, the parents, and everybody on the common illnesses that affect children while growing up. And here we want to talk in a simple language. We want to be as layman as possible so that everybody is able to understand. So then I welcome you back to my channel. So today's topic is on the continuation of what we had last time on the normal growth and development. And now today we are seeing the parameters that are used in measuring growth. And we have three important parameters. Number one, we have the weight, and the weight is in kgs, it is in kilograms. Another parameter we use is the height, and this is in centimeters. We also have something we call head circumference. Head circumference is also in centimeters. So those are the three parameters that we use to measure growth. And the weight is the most sensitive parameter for measuring growth. And we're going to say that in the first week of life, the babies should gain 150 grams to 190 grams per week. And this is approximately 22 grams per day. So this is what should be gained in the first week of life. Though this one depends on if the baby was born a low birth weight baby or a normal birth weight baby. Just to remind you, who is a normal birth weight baby? A normal birth weight is between 2.5 kgs to 4 kgs. So then if we have low birth weight baby, if the baby is below 2.5 kgs. So then after the first week, we have seen that the first week of life, what they're supposed to gain. Then from there, we say after the first week of life, the babies usually reduce, they usually lose weight. Then between 3 to 5 days of life, 3 to 7 days of life, they reduce with 10%. From 10th to 14th day, they regain their birth weight. Yes. At 1 year, the baby should be at least 10 kgs. 2 years, they should be 12 kgs. 3 years, they should be at least 15 kgs. And 3 to 7 years, they should gain 2 kgs per year. 8 to 12 years, 3 kgs again per year. This is what they should gain up to 12 years. Normally there is a formula that is used to calculate, and just to mention that there is a formula that we use to approximate the kgs of the baby. So then we say that a normal birth weight baby should double their birth weight at 4 to 6 months. So if your baby does not double, will not have doubled the birth weight by the time they are 4 to 6 months, then we know there's something wrong. So they should have doubled the birth weight at 4 to 6 months. At 1 year, a normal birth weight baby should have tripled the birth weight. So again, 1 year and the baby is below, it has not tripled the birth weight, then again something is wrong. And this is in normal birth weight babies. But it is different in preterm babies. Remember, we said a preterm is the baby that was born before the 37 weeks gestation. So with preterms, the rate of growth is rapid. They usually grow so fast. It is very funny. Those small babies grow even more fast than the normal birth weight babies. And we say with the preterms, they should double their birth weight. They should double their birth weight in 6 weeks. You can imagine. Remember, the normal birth weight double their weight at 4 to 6 months. So with the preterms, they double their weight at 6 weeks. and they triple at 3 months. So you can see the rate of growth for this preterm, for the small babies, is very, very fast. So that is it about the weight as one parameter of measuring growth. Number 2, we said the height, and the normal height at birth is 50 centimeters. At 1 year, the height of the baby should at least have reached 75 centimeters. That is at 1 year. And from there, again, we have a formula to estimate the height according to the age of the babies. Just like the weight, we said we have formulas to calculate and approximate. We have something we call the BMI. Why the two are important, the weight and the height. We have BMI, and this is the body mass index, and it is calculated by using both the weight and the height. It is usually weight over height, weight in kgs over height in centimeters, and we are able to see the BMI of these babies. The last parameter of growth we said is the head circumference. What is head circumference? We want to measure the size of the head, and we measure from the most prominent part from behind, and we use a tape measure. Remember, we said it is in centimeters, so we measure from the most prominent part of the head coming forward. So we want to see the measurement at birth, and at birth the normal the head circumference at birth should be between 33 to 37 centimeters, and the average is 35 centimeters. So at birth it should be 33 to 37 and an average of 35 centimeters. This should increase with 2 centimeters in the next 3 months each month. It should also increase by 1 centimeter in the next 3 months. So the first 3 months it should increase with 2 centimeters each month for the first 3 months. Then it increases by 1 centimeter in the next 3 months each month, and then 0.5 centimeters in the next 6 months. Why is it important to measure the head circumference? We want to diagnose early conditions like something we call hydrocephalus. Hydrocephalus is when we call it CSF, the cerebrospinal fluid is excess, and it usually accumulates in the head, and the head is unproportionally larger than the rest of the body. So if we measure and the head circumference is too big, we start suspecting hydrocephalus, and we start treating immediately. So this is why we should know the head circumference. Every baby should be measured these 3 things. And again, like weight, it is what we use in calculating the dosages of all babies. We don't use like in the adults. In babies, we calculate the dosages of the drugs using the weight. And we have seen also why we want to know the height, because we want to calculate the BMI of these babies. Again, we have seen the importances of knowing the head circumference. So those are basically the 3 parameters used in measuring growth. I hope now you have seen how babies should gain weight. You have known what head circumference is, and the importance of doing that. So this is it about the growth. It was a short one, and thank you so much for staying with me. If you haven't subscribed yet, please hit on that subscription button. Subscribe, keep subscribing, like, share these videos widely so that many people can reach these videos. And also, don't forget to leave a comment down below. Comment, ask any question, let's discuss. And also, comment, and also there's a notification bell. Hit on it so that you are able to know every time I post a new video here. So thank you so much for staying with me, for listening. Thank you, and I thank you again for continuing to subscribe. Till next time.